will turn on a victim. And that's certainly something we've seen in play this past summer. You know, we've got the case of the 11-year-old rape victim in Texas who was gang raped, videotaped, and you see the cultural bias, the townspeople talking about, you know, the type of clothes she wore, her behavior. You've got the New York Times buying right into it and quoting those folks. We all saw what happened with the DSK case. I mean, that victim, her credibility and her reputation was just annihilated. You had the New York Post go as far as published that she was a hooker. Just some outlandish behavior. So Helen, we'd love to hear about that.
Sure. Quick question for all of you. How many here are journalists? All right, great. I wrote the book Virgin or Vamp, How the Press Covers Sex Crimes as long ago as the 90s, and I did it in response to the Jennifer Levin case, if you remember that one, because my eye was caught by the headline, How Jennifer Courted Death. This was the case where she was sexually assaulted and murdered by Robert Chambers in Central Park, a man she dated occasionally. And the victim blaming was so outrageous that I had to do something about it. So I looked at several major cases of the time and looked at a lot of sociological surveys of how the language we use when we were in newspapers and of how juries behave and so on. And in short, I discovered that there's a list of 8 factors, and the more of these factors are in play in any case, the more likely the woman is, in the case of the victim, and this would apply to men as well, is portrayed as the vamp, the woman who asked for it, the slut. And the fewer of these 8 ingredients she has, the more likely she's to be portrayed as the virgin, the innocent who was attacked by a monster. I have to say right out that that both these narratives are completely wrong-headed and do no service to the fair coverage of rape. I mean, why should a woman have to be a perfect, innocent virgin type to be believed? Why should, and rapists are not monsters. They, in fact, have the most normal psychological profile of any criminal. Here are the 8 ingredients, and you might want to write them down, and just for an exercise, apply them to the cases we're reading today and see how they fit, because they certainly fit those cases just mentioned. If she knows these are the things that count against her. If she knows the assailant, 1. 2, if no weapon is used. 3, if she is of the same race as the assailant. 4, if she's the same class as the assailant. 5, same ethnic group as the assailant. 6, if she's young. 7, if she's seen as attractive. And 8, if she in any way deviated from the traditional female sex role of being at home with family or children when she was attacked. When I say the same race, I should have added the same class and ethnic group, and class, socioeconomic class, the same or lower. It'll go against her. And the thing about the deviated sex role is important because this is when double standards come in. You know, so behaviour that a lot of us would take for granted that we do all the time, like go to a party, go out on a date, you know, take a walk after dark. Suddenly, in hindsight, after a woman is attacked, can be described as asking for it. Now, I have to say one more little thing, if I can, about the press, because I'm not trying to advocate that the press don't reflect what the media doesn't reflect what people say. I mean, the media only echoes what people say. It has a chance to lead it as well. But, you know, people are saying prejudiced things out there. We can't not report what people are saying, but what we can do is balance it by looking for the other people who are saying different things, and they will be there. Instead of just grabbing the sexiest quote we can find, she was a hooker. There's going to be somebody else in that town who will defend her. So, you know, one has to be balanced about this, especially when there is unfair bias at work. Well, as soon as I saw that case come up, I thought of those 8 ingredients, and she had every one of them against her. And I predicted what would happen, and I was horrified, alas, when it did, because, you know, this book came out in 1991, and it was read by a lot of newspapers, and some even published guidelines for their reporters on how to better cover sex crimes. But that mood has passed, and we've gone backwards. And that case, everything about that case shows it. So I urge you, young journalists and media consumers, say to your editors, I have a more original way of covering this story. Write to your editors and say, I don't like the way this story was covered. This is a biased, blaming victim way of covering rape that actually counts against all women. And counts against all people who want justice about this subject. Speak up, because the one thing about the media is they want to please you, especially these days when they're having a hard time selling themselves. You have real power there.
Thank you so much. Karen, can you tell us a little bit in your field? You're the person who's on the ground, training the people who are working directly with an assault victim immediately or very soon after an assault. Tell us how biases play out, whether it's the reporting that happens in a police report that you see, or a medical report, or in the ER room with doctors.
Well, first I'd like to say, as a forensic nurse, and that is my area of specialty, we have, as a profession, come a long way in the last 20 years. But unfortunately, we still have quite a long way to go. The way I see biases play out in emergency departments, for example, is language that's used. When I trained nurses and doctors, and even when I was trained to document the medical record, we were trained to be objective. So, for example, we didn't use words like alleged or rule out. Now, those words are very commonly used in the emergency department. You come in with abdominal pain, they're going to rule out appendicitis. When a person, woman most of the time, comes to the emergency room and has the courage to disclose that they have been raped or sexually assaulted, or that their body was touched in some manner without their permission, or even that they think they might have been touched in some manner without their permission, what healthcare providers have to remember to do is, it is not up to us to draw a conclusion as to whether something did or did not happen. It is our role to document objectively what the patient tells us, to document objectively what we see. And if we go on to court and testify, and if we are asked to give an opinion, our opinion should be based on if what we saw is consistent with what the patient says. I would never, ever say in a court of law or to a police officer or to anyone, yes, the patient was raped, because I don't know. Rape is not, first of all, a medical term, it's a legal term. And the only person who can say are the findings of facts, and in the courtroom that's either the judge or the jury. But what I can say is, these are the findings that are documented. Sometimes I can call them injuries, sometimes I have to call them findings, because all I know is this is what I found when I examined her. I can't always even say if what I found is an injury. I can just say it's there. And is it consistent with what she said happened? Yes. But could it be consistent with something else? Yes. So we have to be a lot more objective. We should never use terms that are frequently used in ERs like AOB. Those are the initials for alcohol on breath. And I would never write that, because most of the time, well, 100% of the time, I haven't seen that patient take a drink. I don't know that that's alcohol on her breath. Someone can come in who has a history of diabetes, and their blood sugar could be so out of whack that they can smell like they're intoxicated on rum. But it's a medical reason causing that odor. So I can't say it's alcohol on breath. So the more objective way to document that would be to ask the patient, do you remember what you had to drink, how much it was, and over what period of time? So instead of writing she was drunk, I may write that her speech was slurred, if that's what I saw, that she had nystagmus, meaning her eyeballs were sort of going back and forth, that she had difficulty staying awake when I talked to her, and that she stated she drank 4 40-ounce bottles of Old English beer between the hours of 8 p.m. and 12 midnight. Now that's a much more objective way to document, as opposed to saying the patient appears drunk. What does that mean? That's me placing a value on her. Now, I'd like to be able to tell you that with the training, with all these fancy forensic programs we have around the country, and especially New York City, that those subjective ways of documenting no longer occur, but that would not be true. Unfortunately, people, doctors, nurses, healthcare providers are still using the wrong terms and the wrong language.
And how does this, the fact that this may happen, what's the end result? I mean, how can this be damaging?
Well, what we know based on research is, first of all, it takes a lot of courage to come forward and disclose a rape or sexual assault to anyone, be it a best friend, be it a family member, be it law enforcement, or be it a physician or someone you trust. And what we know based on research is if the first 1 or 2 people that you talk to about this are not compassionate, and especially if they act like they don't believe you, then you are less likely to tell anyone else. That stands for children as well as adults. And so if first responders, be it the patrol officer in uniform, the person that's in the ambulance, or the nurse that takes the story in the triage area of the ER, if they have a preconceived notion or a bias or treat you in a certain way, that can totally shut the person down. And unfortunately, it can delay proper medical care, and it can most adversely affect criminal justice. And then we know if criminal justice is affected, then perpetrators are not held accountable.
Yeah, I think you were giving me an example. If someone writes down acute distress not evident or something.
Yeah. Another very common term that you'll see in an emergency room record would be NAD. That means no acute distress. Now, when a healthcare person writes that, that means that their blood pressure is normal, they don't have a fever, their breathing is easy, their color is good. That means their vital signs are not distressed. A lay jury, when they read no acute distress on the medical record, they think she wasn't upset. So if she wasn't upset, how could she have been raped? Because people have their own preconceived notion about what a person looks like after they've been raped or sexually assaulted. So we have to be very careful what we write. And I always train nurses, but especially doctors. You must document that medical record objectively, but you write that note as if your grandmother or your 12-year-old child was going to read it. Don't assume that the people in the jury know medical terms, If the bruise on her arm is round and the size of a quarter and purple in color, then it's okay to write purple round area the size of a quarter on the arm, as opposed to a 3-centimeter ecchymotic area on the right upper forearm. What does that mean to the jury? It means a lot to me, because I know what ecchymosis is. But how many of you out there know what it is or even know how to spell it? You see what I mean? So you have to be really careful what you write on record.
And I know you've been an expert witness in many court cases, and so you can see, a number of biases that you pointed out.
That can then play out in, that can play out in the courtroom,
Yes,
Do you think that someone wasn't in distress?
I most recently testified in what's being referred to in the media as the rape cop trial, the Moreno and Mother trial, and I did not examine the woman that, I'm going to be objective here, I did not examine the person who accused the police officers of rape or sexual assault. But I did review her chart and was called in to comment because there was a finding of an area on the cervix during the exam. And it was photographed and it was clear and it was right there. And it was extremely consistent with what little she remembered as having happened to her. And during the cross-examination, the defense attorney actually compared the vagina to a Venus flytrap. In the trial, and this was an educated man, and it got a few chuckles from the audience and admonishment from the judge, and then unfortunately the next day in the newspaper, all you saw was pictures of Venus flytraps all over the place, and it was like, regardless of whatever else I talked about, the little red mark on the cervix, what made the newspaper was the Venus flytrap comment.
Well, we look forward to hearing a little bit later about some of the changes and additional things that you see that need to happen in the healthcare industry. Can you guys hear me okay right now?
Yes.
Yeah. Okay, good. Next, Nancy, I'd love to talk to you. You're also in the front line in a different way with activism and with young people. You're on college campuses a lot. We talked about intoxication, the way that it's could possibly be recorded in a medical report and how it could come back to really be used against a woman. You know, I have to say, at NOW-NYC, you know, we have a lot of interns that we work with, and you know, semester after semester, we hear these stories about just how common it is for young women to, you know, be at frat parties, be drunk, and get raped. You know, and end up often blaming themselves. Can you talk a little bit about your work and what you see on college campuses in this issue?
Absolutely. It's so amazing to see so many students here. At first I was expecting sort of more adults in the room, and I was going to tell you about your culture, but you all know your culture. So listening to the 8 things that make you, I guess, either a virgin or a vamp, I come to my work as a sexual assault survivor who got 8 out of 8 in the vamp category. I guess, I think.
I was 5 out of 8.
I was counting like, oh, yep, that one. Yep, 8. So yeah, I really believe in the power of personal storytelling and bringing your own and my own story to the work that I do. That is also part of the film I made called The Line. And the film works to unpack and address victim blaming for those instances that Cosmopolitan magazine called rape, which is really just rape except at a party, or rape after you've had 2 beers, or any of these things where people like to say, oh, it got blurry, it was, you know, it's gray. That was sort of my experience. I knew the person, I was engaging in consensual sexual behavior, and then I was raped during the experience, and there was some alcohol involved. So it's really this very messy thing that a lot of students I talk to have had pretty much the same experience. And I wanted to talk about alcohol because it came up in a really poignant way with the Moreno Mata case. Basically, a young woman, 27, could have been me, could have been any of you all celebrating a job promotion that I hope you all get when you do get jobs, leaving in college. She's celebrating promotion, she's partying, and she is punished because she was drunk at the time. That was the kind of key to the whole case. And so I thought, it's a little cheesy, but I thought I would quote Jamie Foxx and his song Blame It on the Alcohol. You know, she said she usually don't, but I know that she front, because shorty know what she want, but she don't want to seem like she's easy. Blame it on the goose, got you feeling loose, blah, 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 blame it on the alcohol. And I think every campus I go to wants to talk about, well, you know, they were drunk, and alcohol is used as a shield. Number one, women are still punished for being sexual beings, right? So she doesn't want to seem like she's easy. I hear that all the time, right? We're supposed to be sexual, we're out there, you see it in the media, everyone's having a good time. But if she's sober and she's asking for sex, whoa, she's like, what is she, a sex addict? You know, so a lot of, you know, students feel like, well, I can't really approach this person unless I get wasted, or I'm ashamed of my own sexuality, or I'll be punished for my sexuality. So I'm going to blame it on alcohol in that way. And I think when a woman is deemed a slut and is punished for it, she becomes, in a sense, unrapeable, right? Because then she's not the perfect victim. She's actually very unsympathetic. Then there's this thing I hear a lot, which is like, well, what did she expect? What did you expect? You know, she went to that party, you guys were really drunk, I mean, you didn't really know him. What do you expect? And what I expect when I go to a party is to have a good time. And what I expect when I go home with someone for sex is to have great sex and have a good time. And I would hope that students expect that too. Like, we really need to raise the bar about what our expectations are of each other and our nights out. Because if sex isn't fun, then you shouldn't be doing it, you know. And again, that kind of circles back to the shame part. And then where I see so many students blaming themselves is the statement of, well, she put herself in that situation. You know, well, I put myself in that situation. And again, it's what you said. What situation? Going out on Friday night and having drinks like everyone else in college in America? Or, you know, going to a party? It's just like totally normative behavior, but the second there's a sexual assault in the mix, it's the woman who's completely under the under the microscope. And again, it just sort of cycles back that no one's the perfect victim, because no matter what you do, even if it's the most normative college behavior, yeah, the woman is always under the mic. And then just to add in, to add in the pop culture element to it also, I don't know, have you guys seen the Jersey Shore? I'm sure. You don't need to watch a lot of it, but the bottom line is, to get the message, right? But I mean, the bottom line is alcohol and consent don't mix. And, you know, if someone is incapacitated or drunk, they cannot consent. If she is vomiting, she's not consenting. If she's falling down the stairs, she's not consenting. If she's passed out or going in and out of consciousness, she's not consenting. And then you flip on the Jersey Shore and you see someone fall down the stairs, take shots, and go to bed with someone. And it's really, I think it probably affected jurors on the case of Moreno Mata. Well, what if she did really like him? I mean, maybe she wasn't that drunk. You know, and if the taxi cab driver calls the police because he can't get you out of his cab, she's pretty drunk. You know, and that's illegal. And yeah, so.
Yeah, I was reading an expose that one of the jurors wrote, and I mean, you see the bias in there. First of all, they didn't like the prosecutor. She was sarcastic and coy. They described the defense attorney as handsome and dapper, maybe, but you know, well dressed.
Yeah, they were.
And then he says there were holes in her story. Well, of course there were holes in her story. She was blacking out, in and out of consciousness. But she woke up because her head was banging the wall because she was being penetrated. You know, so it's really frustrating. Okay, so we're also going to come back. We're going to come back to the questions and talk a little bit about what we can do. And we definitely want to hear about what's happening on some of the college campuses you've visited, so we can kind of take that forward here in New York City. John, we're so glad to have you here. And, you know, you kind of got the $1 million question, I guess. You know, it's like men, manhood, rape. Can you talk to us about the stereotypes about manhood? Directly speak to this issue of rape and break it down for us a little bit.
Sure. First of all, hi everybody. I've done a lot of work about the relationship between ethics and identity, and by that I mean, how do you know who you know? And, you know, a simple example, she thinks she knows him well, and she thinks she knows him. And then he does something, and she says, who are you? You know what I'm saying? It's like that sense in which our choice-making, our cumulative choice-making becomes the character that we are perceived to be, and in fact becomes the character that we are. And the reason I think this is important is for two reasons. One is I think it has a real, it's central to the way in which we send out prevention messages, which I want to get to.
Oh, sorry.
And the other thing, the other thing is, I'm speaking now to the people in the room who are raised as men who are part of this, and I think it's really important to kind of get a handle on this issue of one's own relationship to one's choices and who that makes one become and who that makes one in the eyes of the people one cares about. It's kind of important to ground oneself there, and it's partly because having heard the stories from your female friends and sisters of their experiences and having maybe known who did it and having maybe known perpetrators in your own social circle, it can be very, very dislocating and very, very ungrounding in terms of how do you be present and be responsible and play a real role in the work of preventing and ending and interrupting sexual assault. I did a piece years and years ago called Rapist Ethics, and in it I basically talked about the model in which a lot of us raised to be men are raised, and that is that when you do something wrong, it isn't you who did the wrong, it's the one to whom you did it who did the wrong. And this plays itself out, of course, in rape myths. The responsibility, the accountability for the perpetrator, for the perpetration of the act, is shunted, the perpetrator divests himself of it and foists it all on the person to whom it was done. She did the wrong, and in fact she internalizes that. I was the one who did the wrong. That's rapist ethics in a nutshell. That's the way in which accounting for the values in the action, the choice making, it gets completely skewed, and it works its way out in the way in which gender is played out and inhabited in the society a lot as well. Which brings me round to how rape myths hurt men. I asked Sonia if it's okay if I said that, and she said, yes, we need to talk about it. And by that I mean the mythology in the culture that stigmatizes women, that blames women, that holds them to account for that, which was done to them. It all is a way of uncentering men's own sense of self. And by that I mean the very core identity of oneself, which is not about oneself as a man necessarily. It's oneself as someone who makes choices, who takes responsibility for those choices, who isn't always perfect, who sometimes makes mistakes but takes responsibility for those mistakes. That core character, which everybody needs to be known and to know anybody and to connect meaningfully with anybody else. Everybody needs to be in that centered self. Rape myths displace it. Rape myths mess with it. Rape myths blow it up, really, and make it something that is unrecognizable. And I don't know if you want me to go on, but in the prevention messaging that I've worked out, it's always come out of that sense of how do you talk to people raised to be men in a way that speaks to them as if they're capable of moral choice making, because I really think that is an important key in how we do the prevention work. You have to enforce that possibility. You have to speak to it as if it's there. Men need to be addressed as if that is expected of them. They need to be held to that standard. They need to be held to that standard by their men friends and by their women friends. So the prevention messaging that I've come up with, it began with 6 words, probably the best 6 words that I've written. My strength is not for hurting. I don't know if anyone, if you have seen the prevention materials that come from that. It spun out in lots of ways. So if I paid for the date, she didn't owe me. So if she wanted me to stop, I stopped. So if she said no, I said okay. It was all about modeling and affirming positive behaviors that came out of a sense of self that's reflected in that line, my strength is not for hurting. And it's a statement about selfhood, and it's a statement about capacity for choice making. When the Department of Defense came to ask for a version of that campaign for it was the Sexual Assault Prevention and Response Office, it's part of the DoD. And they had been following this campaign and were very interested in it. Unfortunately, the civilian version of it didn't translate because the civilian version is all based on consent. And that really wasn't the messaging that the military needed. The military needed messaging about encouraging reporting. Enormous numbers of people who are victims of what they call unwanted sexual contact, which is their umbrella term for everything from unwanted touching to rape. They're very reluctant to report for lots and lots of reasons.
80 to 90%.
It's huge. So that we needed to message the importance of reporting, and we needed to message bystander intervention behaviors, that is interrupting that which you see happening, that if you stepped up, you could prevent something from happening. So I started with a line called Thinking in Terms of Military Culture. A line that wouldn't work in the civilian world, actually, but it works fine in the military. Preventing sexual assault is part of my duty. It kind of came from, it's part of my job, right? But in the military, it's part of your duty. And the campaign was kind of built on that. There was I said, use the URL, myduty.mil. That was all the messaging was about, this is my duty, or this is part of my duty. Interesting sidelight, some of the lawyers up the chain, and one of the branches, I won't name which it was, got a little nervous about this framing of the issue. They could see down the road, exposure to liability, because if this is part of your duty and you don't do it, then your employer is liable. And this was before the lawsuit from which, who's the plaintiff in that, Swan, is it? Or
No, it's a lawsuit against the Pentagon and both the Defense Secretaries Gates and Rumsfeld on behalf of 17 women and 2 men in the military who were sexually assaulted.
So for a lot of reasons, when I heard about that, I said yes. But the precursor was these nerves among the lawyers, and they probably well-founded, but Sapros dodged that by framing it as moral duty. Anyway, it passed. It went into the campaign. And I'm pleased to note that in a survey conducted a year after the campaign rolled out, some 93% of men and women indicated they felt it was their duty to intervene and to stop something from happening that they saw about to happen. So there, and some 40% had heard of the My Duty thing. So I feel a little bit of progress was made there in terms of framing the issue in an entirely new way. The Pentagon was not doing that until I wrote those words down. And I think that's kind of cool. The point I really want to make, though, is that I didn't come up with that out of the blue. I came up with that out of thinking deeply about this relationship between manhood and ethics and character and identity. And I think these are really very important themes in everyone's life, but I particularly want to bring them into the conversation about rape prevention, because it's building and modeling character that is capable of knowing the difference between rape and not rape, and is also capable of taking responsibility for interrupting and for comfort and solidarity with those who have been hurt.
And that's a question we do want to talk a little bit about, bystanders. But since we started on the topic of military, Helen, I wanted to ask you, because I know that you have a book, Lonely Soldier, and that your work in this area actually helps spur this sexual harassment suit against the Pentagon. And it's interesting that, we've been in a protracted war for so many years. We've got service men and women who've had multiple tours of duty in unprecedented numbers. So, it's no surprise that this issue is coming to light so much in the last few years. But I'd like to get your views on that.
First, I just want to say I have a vision in response to what John was saying, which is that the motto of the military would be, "My strength is not for hurting."
Unfortunately, they're trained to kill.
Only for peacekeeping. That's my point. Wouldn't it be a nice change? That's why it's a vision.
Thank you. It was nice. I thought of it too.
Yes, I've written 2 books about conditions for women soldiers. One non-fiction and one fiction. The Lonely Soldier, the private war serving in Iraq. I interviewed is the non-fiction, and the new one is Sand Queen, which is a novel about a woman soldier and an Iraqi woman in the Iraq War, because I thought it was time to pay attention to what was happening to Iraqis as well. Lonely Soldier and Iraqi women in particular, 90% of casualties in war these days are civilians, and 75% of those are women and children. So it's time that women seize the pulpit on this one. For The Lonely Soldier, I interviewed 40 women who served in Iraq, many of them in great depth, and went into the studies. That's where it came out that the Defense Department's reports themselves say that 80 to 90, depending on the year of the report, % of sexual assaults are not ever reported. Looking at the military, before you all start turning off and thinking, why should I care, is really important for looking at our society's attitude toward rape. Because it's like a microcosm of what goes on in our society under a magnifying glass. Because in the military, all the what we might call old-fashioned attitudes towards women are alive and well. Women are seen as second-class citizens. They are sexual prey. They are not taken seriously. They have to quote one of my soldiers, be twice as bad as the boys to even be taken seriously at all, no matter what their politics are and how gung-ho or critical they are of the military and of our various wars and missions at the moment. I hear this from all sides. I maintain through my research that, that the rate of sexual assault of women is about double in the military than it is in civilian life, or close. And when women are sexually assaulted in the military, there's no escaping their assailants. They're trapped with them. There's no going home from the office. There's no running home to mom and dad. There's nowhere to go. And more often than not, the assailant is a higher rank than the victim. And by the way, latest studies are showing that some 20 to 30% of rape victims are men, assaulted by other men. So it's not just a women's issue by any means. So what happens to women in the language that's used routinely within the military about women reflects what goes on at large, which is why I really urge you to look at it, because it'll get you thinking about it. I want to say a couple of other things, though. As the mother of a 19-year-old daughter who's just a sophomore now in college, I am really distressed by the backlash that's going on, the 1950s style attitudes towards young women these days. I feel as if I've gone back to before my teenagehood. The double standard is alive and well, the Don Juan versus the slut. The hookup culture is giving young men a sense of entitlement. I mean, these values that John was talking about is something that they have to be taught from early on. I mean, men should be growing up. We should be nurturing our sons to understand that rape is an act, that sex should come out of desire, and that the great pleasure for both the man and the woman is to feel the desire of his or her partner. And if the desire isn't there, then leave it alone. I mean, that's step one, it seems to me, and I'm lucky enough to have men in my family who feel that very strongly. They don't see any point in sex if you don't feel the desire and create desire in your partner. Nobody talks about that anymore, but I think in order to understand why there's no such thing as grey rape, we should be talking about what healthy sex is more, what fun sex is, as you mentioned, what lovely sex is. And it isn't about coercing and tricking and waiting for the girl to get drunk, or and so on and so on. That shouldn't even be in the equation, and it should be obvious that it's not in the equation. I gave a lecture at West Point recently, and a young man stood up and said, how am I supposed to know whether she wants it or not if she's acting all hostile to me when we go out? And he was a genuine question, and I just wanted to say, you know, where are your parents? I'd like to have a talk with them. Where did you get this from? And it isn't just from, well, we know it comes from everywhere. It comes from music, it comes from all pop culture, it comes from peers, it comes from television, it comes from media, it comes from each other. So I just thought of that, listening to all this and seeing your young faces, and when I said that about the attitudes being backlash, I saw lots of nods, and I think it's time for young people to really make a fuss about this, and to hell with being afraid of being labelled a feminist. You know, that's
I love it. You've given me a new term, lovely sex. So, you know, and you've already started the conversation talking about, you know, the new ways that we need to talk about it and how important that could be. And John, your discussion about changing the paradigm and everything. Can we talk a little bit about what we can do moving forward? I mean, Jane is going to talk a little bit about, the issues in the criminal justice system and how we can work on that. But from your perspectives, whether it's the work that still needs to be done, the problems and the work that needs to be done in the healthcare industry or on college campuses, Nancy, or anything that you want to talk about in that area.
Well, I can speak for healthcare. I did mention before that we have come a long way in 20 years, but we have so far to go. There's a public health law on the books right now that's in New York State that says if an adult comes into the emergency department stating they've been raped or sexually assaulted, automatically certain things should kick in. They should first be offered the option to have an exam. They should be offered the option to have evidence collected. They should be given the option of having an advocate, someone there just for them. They should be told about antibiotics to prevent sexually transmitted infections. They should be told about medication to prevent pregnancy. And they should also be told about, if they fall within the 36 to 72 hour window, depending on where you work, medicines that could possibly prevent them from getting the HIV virus. These are all laws on the books. Now, it's a shame that you have to legislate what should be considered normal, routine health care. But unfortunately, that's the world we live in. And also, unfortunately, there's no one watching, so there's no way to know whether or not these laws are being adhered to. So how do we change? Well, change starts with every one of us in this room. I mean, if you go to a shoe store and you don't like the way the guy that's trying to sell you shoes is approaching you, you leave and you don't purchase the shoes. I mean, we have choices when it comes to healthcare, and we have to speak up. And if things don't go right, we have to make a noise. And we have to be agitators, and we have to make people uncomfortable, and we have to report when things don't go the way they're supposed to go. I think we as people have a lot more power than we think we have. We just don't use our voices. There are a lot of times when people sue healthcare facilities because they didn't get proper care. But the one person that's least likely to sue is going to be someone that's coming in found rape or sexual assault. That's just not going to happen. I mean, because of a lot of different sets of circumstances, at least not right away. But I think that we do have to hold our healthcare professionals accountable. Now, we do have wonderful programs in certain hospitals throughout New York City and other parts of New York State that do provide state-of-the-art care. But there are also facilities that are providing substandard care. And I think that we need to hold accountable those that are not doing well, and we need to praise those that are.
Okay, great. Anything on bystanders? We have a few more minutes for this section.
I just want to say, excuse me.
Yeah. Oh, we'll just get online. Yeah, I was just thinking up when, no, it's okay. When we were talking about 1950s mores and this culture, and how important it is to bring kind of a sex-positive approach to violence prevention, it kind of cycles back to this shame idea, where the less women feel empowered to ask for the kinds of sex that they want and ask that their boundaries be respected, and the more sexual assault will be cloaked in shame. And speaking of messaging, we came up with this campaign called the Line Campaign. I'm on Twitter at the Line Campaign, and really formulating a question for our audience, which is, where is your line? So the film is called The Line, and it's about consent and rape and assault, and it's sex, and then it becomes rape. Where is it for the audience? And I have hundreds and hundreds of responses from students that really blew me away. One was, where's your line? The answer, it changes. Please ask. Please listen. Another one is being seen as a sexual being, not a sexual object. Another young man said to me, wow, I've never been asked that question. Male privilege. And that's pretty interesting. That comes up a lot with men. Like, I've never thought of it. I've never, as a man would say, I've never thought of that myself. And oh wow, I'm not thinking about it for my partner. And if a young woman doesn't feel empowered enough to say, wait a minute, I want to do this, I don't want to do that, I'm going to keep speaking up. Like, there's just been such a lack of sexual education in the past 8 years under the Bush administration. So beside the fact that we don't even get biological info, young people don't get information about negotiation, navigation, respect. So to end on a song lyric that's actually positive about how to sort of ask for sex in memory of Tupac Shakur. The opening lines of that song, how do you want it, how does it feel? That's really hot. And when people say, oh, I don't want to ask, it'll kill the mood, which is, you know, wow, that mood is fragile. We need to be creative about getting our messaging around asking and making consent sexy, making this kind of negotiation. It's called seduction, and seduction is not coercion. And exciting stuff going on campus. I think the sex-positive approach to violence prevention that we're doing and some other folks are doing is exciting, and I know about the New Hampshire bringing the bystander program, which I've heard some really great things about.
Speaking of being creative, every time when I think of this room, I think, well, what if there was a Twitter feed here and everyone was tweeting their ideas in answer to this question to hashtag how stop rape or something like that. And the wall would fill, because this is a very, I mean, you wouldn't be here if you didn't have creative and motivation on this. So I'm hoping maybe in the discussion some of this will come out. To the point about bystander interruption, I mean, I think that by intervention, this is that thing that really just goes against your socializing if you've been raised to be a man. It's, you know, breaking bonds with the people you're supposed to be allied with. You're supposed to be one of the guys. You're not supposed to stand off alone. That's weird. You're not supposed to challenge the group cohesion into which you're desperately seeking to fit. And so the courage to interrupt, to be the bystander that doesn't stand silent but speaks, that intervenes, that is a real kind of act of moral courage if you've been raised to be a man, especially because it is reconnecting to that sense of self that knows the difference between right and wrong, that knows the difference between right choice making and wrong choice making, and in that moment knows that I am not who I think I am, who I want to be, unless I make this choice to interrupt.
Thank you so very much. I know you guys have a lot of burning questions. We are going to get to them very soon. But as I mentioned earlier, our President Jane Manning, who is a former sex crimes prosecutor and who has been an activist in this area and involved with NOW since the early 90s and has been instrumental in a lot of the in all the work that we've done at NOW in this area and in our Take Rape Seriously campaign that I outlined earlier, is going to walk us through some of the issues in relation to the criminal justice system, the ones that I gave you a little snapshot of earlier. So please join me in welcoming our fearless leader, Jane Manning.
Thank you so much, Sonia, for your brilliant leadership, and thank you to our wonderful panelists. As you have made so clear tonight, if we want to be a movement that stops rape, there are so many pieces of the picture that we have to change. Our military institutions, our educational institutions, our media institutions, the institution of parenting, which thank you so much for mentioning, because what we're doing to our little girls is making me sick too, as the mom of 2 little boys. The institution I want to touch on in my comments to you now is our criminal justice system. And I only have time, as Sonia said, to give you a snapshot of where things stand concerning its handling of rape cases. The quickest way to sum it up is we've come a long way. We still have a very long way to go. A generation ago, hardly any rape case, I have see you nodding as one who's in there. A generation ago, hardly any rape cases were ever prosecuted. And when a rape case went to trial, the trial was often described as a second rape for the victim. It's not like that anymore, and the reason it's not like that anymore is that feminists got out and fought for change and made change happen. But we are still a very long way from where we should be. And in recent years, we haven't seen enough progress in this area, partly because we haven't been making enough noise in this area. And so a year ago, our chapter, NOW-NYC, launched a vigorous campaign called Take Rape Seriously. This panel is part of that campaign, and our work on criminal justice is also part of that campaign. And I want to give you a few quick examples of the many changes still needed in our criminal justice system. I'll touch on 3 areas. The laws that are on the books as they pertain to sexual assault, the laws as they're being interpreted by the courts, and the implementation of the law by law enforcement. And again, just a few quick examples. So the laws as they're on the books. This is an area where in recent years NOW-NYC has actually had some tremendous victories. In just the last few years, our chapter has waged successful campaigns to eliminate the statute of limitations on rape cases, to get New York State to pass its first law against human trafficking, to get a law passed against strangulation attacks, which are very commonly part of sexual assault, but weren't considered assaults until 2 years ago. And last year we pushed through a law to keep guns out of the hands of batterers. Did you say duh? There's still a lot of changes needed to our laws. I want to give you a couple of quick examples. So in New York State, the laws are very archaic pertaining to sexual abuse and exploitation of women and girls who are mentally disabled or who are too intoxicated to be able to consent. There's a very difficult threshold, a very narrow definition of what constitutes mental disability, what constitutes incapable of consent. Prosecutors who want to charge these cases are finding that the laws are too restrictive and that the cases get dismissed. Other states have better definitions of what constitutes a mental disability, what constitutes too drunk to consent to sex. New York State should be looking at some of those better definitions and adopting them. Another quick example, legislative reform. If a rape case goes to trial and the victim testifies, let's say she's been convicted of shoplifting, she can be cross-examined up and down by the defense attorney about that shoplifting conviction and all the details of it and why it reflects badly on her credibility. Let's say now the defendant, the guy who's accused of rape, let's say he's got 7 prior convictions for sexual assault. The jury, in almost every case, very, very rare exceptions, the jury will never be allowed to know that the guy is a 7-time convicted rapist. Where did I get the number 7? From a real case, People versus Vargas, where the guy's conviction was overturned because the trial judge had ruled that the jury could find out a very limited amount of information about this rapist's 7 prior convictions. That's just crazy. It's an area we'd like to work on. As the new legislative session approaches, we'll be looking at the issues I've just mentioned and other lingering injustice for women in our laws, and we'll be deciding which of them look ripe for reform. I hope you'll watch for our action alerts, and I hope that you'll be with us. Second area, the laws as they're being interpreted by our courts. And I'm sorry to say that here, in recent years, not only has progress kind of stalled, but we've even seen some backsliding in terms of how our appellate judges are interpreting our laws on rape. One example, we're seeing a real undermining of the rape shield law. A horrible case called People versus Hunter, in which a woman was testifying in a rape trial. She was the victim who had reported being raped. In an unrelated case, she had been raped by a different man. Now, if you crunch the statistics on how many rapes are occurring in our society, it's not at all unlikely that a woman could be raped twice in her life in 2 utterly unrelated incidents, okay? The appellate court overturned this man's conviction, saying that the defense counsel should have been able to seek to cross-examine her about that unrelated rape case, even though at the time the appeals court heard the case, the guy in the unrelated case had pled guilty. So the court knew that she had been telling the truth in that other case, and still said, no, getting raped twice, that's a little fishy. The defense attorney should have been able to cross-examine her about an utterly unrelated rape, even though we know it really happened. The takeaway here is it matters who's on the courts, and it matters who's on the appellate courts. I've been shocked, in fact, by some of the misogyny that I've seen in New York City and New York State judges. What is NOW-NYC doing about that? Well, one thing we can do is support pro-women candidates for judicial appointments. Right now, we're very proud to be supporting a judge named Doris Lynn Cohen, a longtime champion of marriage equality, a champion against domestic violence, and we are lobbying the governor to appoint her to a higher court. Do we have letters available tonight? Yeah, we have letters available for you to sign in support of Judge Lynn Cohen. On the appellate courts, don't underestimate the difference that a few forceful voices for women can make. We've seen that, and we're trying to get more of them. In the third area, and again, this is just skimming the surface, but our laws as they're being implemented by law enforcement. So how well are the laws against sexual assault being carried out by our police and prosecutors?
I'm going to swig while you wonder about that.
Is this mine?
Okay.
The answer is, it's a very, very mixed bag. In the police department, there's a wide range of quality of work being done by cops. Some very good work, some very bad work. We saw some shakeups in the NYPD last year on this issue. They didn't come a moment too soon. Among DA's offices, it's really important to understand that every district attorney in every county is their own independent elected official with jurisdiction only over that county. Some of them are doing really good work on crimes against women. Some of them are doing really bad work. But in general, as we look around at the various offices, what we are still seeing far too much of is prosecutors asking the question, is this the kind of rape that matters? Is this the kind of rape victim who matters? And we see a real two-track system, much like the one you've written about in your book, Helen, in terms of the media's perception of rape. But prosecutors, as part of our culture, do the same thing. Are these the kind of rapes we take seriously, or are these the, to use a phrase I've heard, the bullshit rapes? Which cases get shunted aside, get short shrift as the bullshit rapes? It won't surprise you to hear the answers. Acquaintance rape cases, which is a huge problem because acquaintance rape cases are 80% of rapes. Rapes that happen in someone's house, which are the majority of rapes. And rape where someone is intoxicated. Again, a huge number of rape cases. And I'm talking about rapes that meet the legal definition of forcible rape, but someone was drunk and the case is taken less seriously. Cases like these are given careless handling and low plea bargains, or even not charged as rape at all. What you need to know about this is that district attorneys are intensely local officials. And that's a good thing, because women who organize in their own communities can make a huge difference on a district attorney, even in relatively small numbers. There was an article written by our wonderful John Stoltenberg some years ago. If the best 6 words you ever wrote were "my strength is not for hurting," the best 5 might have been "making rape an election issue." It was an article that I read, maybe 20 years ago, and it had a huge impact on me. And that is what NOW-NYC is trying to do to this day. So when there was a contested election for Manhattan District Attorney, we hosted a candidates forum to make sure that issues of violence against women were pushed front and center. Now we have a first-term district attorney, and we are ever vigilant to give positive feedback where it's merited and speak out when there's a problem. One example of what would be considered a problem, the case of Tony Simmons, a juvenile court counselor who was raping incarcerated girls while they were in his custody. And the Manhattan District Attorney's Office offered this man a plea bargain for probation for raping 3 girls when we knew about 2 others that he had raped, and one of those girls was 13. Probation for that. Now NYC took to the streets to send the message, this outcome is not acceptable. That is not how the women of NYC want you to represent us. A couple of other cases I'm going to skim over just in the interest of time, but I do want to say a word about the recent acquittal of 2 New York City police officers on rape charges. Heartbreaking. There's so much to say about that case, but in a nutshell, that was an extremely strong case that should have resulted in a conviction. And the fact that it didn't should raise very hard questions both for the district attorney's office and for the community as a whole. NOW-NYC has been conducting street demonstrations, media work, and meetings with the district attorney's office to make sure those hard questions are being asked, even when they're not particularly welcome. A district attorney makes decisions about which cases are going to be high priority. The district attorney I worked for, really, in his office, you didn't want to mess up a car theft case. You didn't want to mess up a graffiti case, because the community had let that district attorney know, we're up in arms about all the graffiti in this neighborhood. It matters what a DA is hearing that his or her constituents care about, and that's why we want to make sure that in New York City, They're hearing about violent crimes against women, because if that's where they're feeling the pressure, then that's where the resources will go. That's where the best trial attorneys will go, and that's where the high standards will be set. In our efforts to win progress, this chapter's activism is making a difference, and I want to know that your participation is so important. It matters that when we're trying to get a bill passed, we can get a legislator's phones ringing. It matters that when we hold a demonstration, 50 people show up. And what I want you to know is that when it comes to this kind of local activism, small numbers can make a real difference, and that means you can make a real difference. For a legislator to get maybe 5 phone calls, 10 phone calls about a bill, they don't get that many phone calls very often. That gets their attention. A demonstration where 50 people show up, that's a good media event. That gets a good district attorney's attention. And so you and 5 friends could be a major part of a successful legislative campaign, a successful campaign to push for better handling rape in the criminal justice system. So what I want to say to you is, if you're not a member of NOW-NYC, please sign up tonight. And if you don't know where to get our action alerts, please sign up to get our action alerts, and please take action. You have taken the first step by being here tonight. I want to thank you so much for doing that. And now we want to open the conversation up for your thoughts, your comments, and your questions for our wonderful panelists. Yes.
I actually have 2 questions. The first one is...
Could you speak a little louder?
Yeah.
Or we'll repeat one of the
Yeah, sure. The first one's for Nancy. You said that alcohol and consent don't mix, which I completely agree with. But on my college campus, whether or not this is true, the perception is that like 90% of sex is when you're drunk. So like when I raise this issue that like being drunk, you know, you usually can't consent, people like dismiss that because like how would sex happen then? So like how do you address that? Like how do you get people to listen that like it's, you know, you can't consent if you're intoxicated?
Did everybody hear okay? And if not, maybe you can kind of...
So the question is, a lot of young people have the idea that, well, if people can't have sex when they're drunk, no one would ever have sex. and so how do you reconcile that with the idea that alcohol and consent may not mix? Nancy?
Right, I feel like that it is the point that needs to be made, but then you can sort of cycle it back to, I mean, who really thinks sex when they're drunk is that good? Actually, if you want to talk about root causes of shame, you know, what are we ashamed of? Are we afraid to be vulnerable? Are we afraid to own what we want, who we like? You know, why are we drinking in the first place to that extent? Number 1. Number 2, physically in the body, a woman, people are numbed out by alcohol. So actually it's not that great sex, it's kind of numbed out. And I mean, you know, if you want to get graphic about it, you can also say men have a problem getting it up when they're wasted. So there's this idea, so it's not because the sex is great when you're drunk. It's not like it's something that's enhancing the sexual pleasure. So if you can maybe talk to people about, okay, let's put aside the consent and the legal piece for a second, and let's look at what are you going for? You know, we're all here, you know, don't you want to have better sex? And the bottom line is alcohol doesn't make it better. So if you are anxious about approaching someone, like, what is that about? Is that about revealing your feelings for someone? You know, and just trying to look at the root causes of why we get so shit-faced when we... Well, that was another thing that came up actually at Stanford. These kids were trying to like, oh, well, you feminist, are you saying if I enjoy getting spanked, does that mean I'm, you know, I can't be a feminist or blah, blah, blah. I don't know. And so if you want to try something really kinky, like, I mean, the kinkiest thing ever, you should try sex when you're sober. And you should do it with the lights on.
There you go. You need to look.
Yeah. And it was like frozen faces of fear. So it's just like getting, you know, inviting people to think about why they are drinking with them.
She has a second.
Okay, this is for Karen. So I'm a sexual violence advocate, and I recently had a really bad experience in the ER with these 2 doctors who seemed really compassionate, but then when it came, unfortunately there was no SANE nurse present, so it was just these 2 doctors. And when it came to interacting with the victim and doing her evidence collection, she was really traumatized, and when they started doing the collection, she kind of freaked out, and their response was really, really inappropriate. And so I'm curious, like, how, these were both female doctors. They seemed, very knowledgeable, very good doctors. So I'm like, I wonder where you think the disconnect is. If they just don't know how to respond to trauma, or if it's, a socialization to deal with things in that way.
Well, I think when people are in situations that make them uncomfortable, they don't necessarily behave appropriately. They may be wonderful physicians, but it doesn't mean that they can understand trauma in the real sense of the word. I mean, granted, they can probably pass a test, a physical test on how trauma affects the brain, but they don't relate that to the person that's right in front of them. A lot of, my experience has been a lot of healthcare providers sort of shun taking care of these patients because, first of all, they don't want to go to court. There's a major fear about people going to court and testifying. Now, I happen to be weird. I love going to court. I'm told that I'm weird. But I think it's the best way to educate a judge and a jury is to be on that witness stand and to talk about something when you know what you're talking about. They don't want to do that. So they will try to talk patients out of having evidence collected, or will try to minimize the person's experience so that they don't want to have to deal with things that make them uncomfortable. And it's all relative. I remember years ago, as a nurse, we were uncomfortable about asking patients if they smoked or if they drank. And that is the questions that are routinely asked. So I just think it's about education. And it's also about accountability. And you know what? Those doctors have someone that's in charge. And I think as advocates, you're going to have to make the noise because that patient's not going to do it. And half of them don't even realize they can do it. And so if you don't feel comfortable, you've got a boss. And one phone call to the CEO of the hospital, you'd be surprised at the difference it'll make. Or the chief of the service that the physician is working under in the emergency department. But if we keep looking the other way, and we don't hold healthcare providers accountable, it's not going to change.
Well, I should say, a lot of times they're under stress. If they're in the ER room, they've got all these patients out there, and but they can't let that affect the work they're doing. I mean, maybe those doctors were just like, oh, I've got all these patients waiting or something. So I love that idea about calling the CEO of the hospital, because that'll change the relationship.
And when you do that, and when you speak out and complain, you're going to feel nervous that someone thinks you're being a pain in the ass. And you know what? Maybe someone will think you're being a pain in the ass. And that's part of why bystanders don't speak out.
And that's what advocacy is.
And that's what advocacy is. So,
I have a question for Helen. Feminists worked for so many years to ensure that rape victims would be afforded privacy if they came forward to law enforcement to bring charges. And it seems like there might be some rumblings out there about, looking at that as, or people saying, should that still be the case? If you're going to accuse somebody, you should have to stand behind it.
Can everyone hear that? So anonymity, the fact that newspapers and most mainstream media in the United States don't report a rape complainant's name if she doesn't want her name to be reported. And that's a change that activists have pretty much accomplished in the last 20 years, and now we're seeing maybe some pushback against that.
We're seeing a lot of pushback. At the Columbia Graduate School of Journalism, I hear more arguments for naming rape victims without their consent than I do the other way around. And those arguments have been spearheaded by women often. I hear them on NOW-NYC as well. Women who say that naming rape victims will destigmatize rape. So if you want a few tools to argue against that, here. I'm just going to read it because it's quicker. The idea that naming rape victims will destigmatize the crime derives from an oversimplified definition of rape. Rape is not as simple as being bonked over the head by a mucker. Rape is an act of torture that uses sex as a weapon. Like a torturer, the rapist uses sexual acts to dominate, humiliate, and terrorize the victim. To deny the role of sexual humiliation in rape is to deny victims the horror of what they've been through. To name a rape victim guarantees that the public will link her name with an act of intimate humiliation. To name a rape victim is to guarantee that whenever somebody hears her name, that somebody will picture her in the act of being sexually tortured. It can also put her in danger from the rapist, if he is still on the loose, from his family, sometimes from her community. To expose a rape victim to all this without her consent is nothing short of punitive. In fact, the issue of whether to name the victim is really cosmetic in terms of how to improve rape coverage. Sex crimes will only really be free of stigmatization when they can be taken seriously without having to hide behind that virginal vamp narrative I opened with. That is, when a woman doesn't have to be perfectly virtuous to believe. And there's one other argument, that naming, which is promoted by Alan Dershowitz, he's been going on about this for decades, that naming the accused and not the victim makes the accused look guilty before proven so, which is completely illogical. It makes no sense to equate the alleged victim of a crime, innocent as far as crime is concerned, with the person who stands accused whose innocence is in question. We don't do this with non-sexual crimes. Do we treat the victims of robbery as if they're as criminal as the robbers? As one rape survivor said to me, only in rape cases do the victims have to prove their innocence. So I've been making this argument for a long time, and I think that the real problem with the way we cover rape is that we don't talk, we do two things at once. We both cover up too much of how traumatizing and violent a crime it is, and that, by the way, it hurts. And it's not just bad sex, and it hurts on all kinds of levels, physical and of course, mental. And so, on the other hand, we sanitize it too much, and at the same time, we push women into this trivial idea of we push the trivial myth, trivializing myths of, rape is bad sex and it's just an act of lust and why are you complaining about it? I mean, these ideas are so ancient, they go back to the Bible. And so we just have to keep kicking back, and sometimes, and progress happens, it's not 2 steps forward, 1 step back, 2 steps forward, 1 step. So that's my answer to that. Thanks for asking.
Okay, right here?
Yes, I noticed throughout the entire lecture there wasn't any coverage about family, and I think that the way rapes are handled inside the family probably says a lot about why the justice system is why it is. I mean, you have to look at how the child is treated by other family members take sides, family members judge the victim, the case never gets brought to trial because of family arguments, etc. So, and that also falls back to the nurturing as well, because if we don't take care of the child at home in a rape case, how can we expect, the entire judicial system to take a stand and say we need to make things better when the own family cannot even take a stand for the child that's been raped inside their own home. Even the neighbors take a side, against or for the child. So I think that says a lot. I don't know.
That reminds me a lot of what happens on campuses, any kind of tight-knit community where, whether it's a team, whether it's your floor, it's like, oh no, now that you've come forward and accused this person that we all really like, you've just totally ruined the party. And it's just easier actually if you hadn't said it. And that's what happened to me in a very tight-knit work environment where I thought I would come forward, So I think that the family example is a really good one, and everything ripples outward.
Because I immediately thought of the 6-year-old girl that was gang raped in Trenton. I mean, these were all men from, I think, 14-year-olds to grown men. I mean, who nurtured these people? And the same thing, when you mentioned the criteria for a rape victim, the first thing that came to mind was Kobe Bryant's case. Yes. His victim was immediately treated like a saint. Yes. He was called a savage by media, etc. But that also dates back to the 50s as well. There were more rape cases against black men when the victim was an opposite race, and very few cases where black men would rape a woman or any other minority woman. So, I mean, this is a really big effort. I mean, it's just, how do you overhaul something where the men, I don't know what to tell you. Because you've got the men writing the stories about the woman that's been victimized. You've got certain comments that they're used about the victim in the paper. I'm like, is this really, really appropriate? Does this really, same as the DSK case. It's like, do I really need to know what happened to her? I mean, his background was equally shady, and I didn't really see much of a focus on his background. I mean, to me, what he said to me it opened a nightmare, a door to a nightmare, because he said she wanted it. That's what she wanted. And that's typically what most rapists typically tell their victims. You wanted it. That's what you wanted. And right then and there, I thought, okay, well, they're going to prosecute this guy, right? But then he gets off with a shady background, a shady past, a previous incident of rape. So, like I said, it's just, this is a really big issue. And how do you overhaul something where the men of the system, including men who probably had incidents in their own family that they probably ignored as well? You know?
Yeah, I just wanted to make a couple of comments about that. I think those are all good points. The interplay between racial dynamics and rape coverage and attitudes is just like that. Rape coverage started in this country with lynching. It's the first stories, newspapers that ever mentioned the word rape were covering, false accusations of rape that were leading to the lynching of black men, and those were the first stories. So the black man attacking the white woman kind of laid a template for what we thought of this as heinous crime, and it's infiltrated, mixed up with class, socioeconomic class, ever since. And the DSK illustrates that, in a twisted other way.
Right.
But I also wanted to say that your point about family also applies to the military, and that's the situation of soldiers. They are seen as traitors and liars and weak soldiers if they report. They are snitches. They are bringing down. It's like the campus life too of the family, because after all, soldiers are trained to see their units as family. Right. So they experience rape as incest. That's another reason why it is so traumatic. Their brothers and their fathers and quotes are doing this to them, and they can't tell anyone because they're seen as traitors and liars and sluts and so on.
Yeah. So I'm not sure exactly who could answer this, but I'm going to put it to all of you. I did a study a long time ago in college, and really focused on the self-supporting structure of victim blaming, not just at the victim, but the victim themselves. Victim blaming, therefore affecting reporting, therefore affecting prosecution, but then therefore affecting victim blaming. So kind of discussion on the definition of force, which by most standards of each state law is the only standard for sexual assault or for rape to be prosecuted at the highest level, except for New Jersey, which has introduced coercion. But like the lack of other options in our definitions of what we consider prosecutable, and how that therefore affects how victims see themselves of what is prosecutable. Oh, that like you said, 80% of sexual assaults are acquaintance-based rape, which are not likely to find the evidence of force. So going back to like Karen, what you said about language and how important that is. How is it that, how can we affect change in not only our definitions so that we can affect change in how people see themselves, and what we do take accountable, what is accountable rape or sexual assault in our society? How can we affect change there? So I don't know, if anyone wants to take a shot at that, that'd be great.
Well, I couldn't just think of it in terms of force or the lack of force. From a purely healthcare perspective, is when I go in to examine, and I'll do my whole examination, and I'll come out and I'll come in contact with a law enforcement officer. And the first thing he says, well, what do you think? And I say, about what? Oh, was she raped? I said, don't know, wasn't there. They think that, people think in general that I can look at a woman's external genitalia and say, oh yeah, oh my God, that's rape. And they don't understand that most of the patients I examine look just like everybody else. When I go to court as an expert witness, it is almost always to explain why there is not an injury. So this whole idea of force and what that means, we're combating it constantly. As an examiner, I'm combating it with other healthcare professionals. In the courtroom, you've got to try to explain it to a lay jury or a judge. I have to explain it sometimes to police, because now they don't want to take a 61 about a report, because I'm coming in telling them that my examination didn't reveal any findings. Oh, well, then she probably wasn't raped. She's got to be lying. You see what I mean? So it's a big issue from where I live, being on the front line.
With that, I just going back to the notion that what is prosecutable is based on evidence and the need for evidence, and just looking at the fact that basically what my paper came up with is our traditional view of evidence and its and how it's necessary for prosecution is directly in conflict with prosecuting the majority of sexual assaults out there, and how do we change that?
That's a great. I like the way you asked that, because what I really want to say to you is that it would be a big mistake to imagine that when a case of acquaintance rape goes to trial, you're faced with a situation where there's just no evidence. The truth is that when these cases are investigated properly and quickly, prosecutors can often, and it's a matter of knowing how to investigate these cases as opposed to money laundering cases or rackets cases or robbery cases. There's a lot of robbery cases where there's quote-unquote no evidence of what happened unless you believe the victim's testimony, right? It's a question of prosecutors knowing what the factual disputes are that are going to be at issue in an acquaintance rape type case, knowing how to anticipate them, investigate them, and come up with evidence that is going to corroborate her story and disprove his story. What will that evidence look like? It will be different in every case, but it will involve surveillance camera tapes. It will involve records of cabs. It will involve cell phone records. It will involve the doorman's testimony. It will involve Facebook postings the next day. It will involve the friends who saw them leave together, the friends who saw her right afterward, the friends who saw him right afterward. It will involve other witnesses. It will involve physical evidence. It'll be different from every case, but the truth is that if prosecutors care about being able to prove these cases, they're absolutely, look, in every case when it goes to trial, there's going to be her story of what happened and there's going to be his story of what happened. And if you've done a really stone-turning investigation, you're going to have some evidence that's in conflict with whichever version is untrue. I mean, you just are. And that's how these cases play out when they're investigated properly. And that's why I really don't like hearing these cases referred to as he said, she said cases. Well, there are a lot of cases, including homicides, robberies, and every other kind of serious crime, where ultimately the jury can only convict if they believe the testimony of a certain witness. And yet in homicides, we take it for granted that, of course, cases are going to go to trial where if the jury believes this person saw that person pull the trigger, and there's no other evidence proving that that person pulled the trigger, that case is a legally sound conviction. It's true in rape cases, it's true in a lot of other cases, and if the cases are investigated properly, they're not he said, she said cases, for the most part. Yeah. So you had your hand up for a while.
My question's for Helen. Would you ever consider adding gender to the 8 factors list, or do you feel that the deviation from sex roles sort of covers it? Asked because the Anti-Violence Center released its yearly statistics recently, and it was reported that male rape goes vastly underreported, specifically in military and prison industry settings. But also rape against trans women is skyrocketing right now, as evidenced most recently by the 3 assault cases on Sunday against women in D.C. 2 were sexually assaulted and 1 was murdered. And how do you think those cases are treated in the media?
Actually, in my first book, which was called Recovery, How to Survive Sexual Assault for Women, Men, Teenagers, Friends and Family. So I wrote about the rape of men against men many, many years ago. And I do cover it in this book, and I do cover it in The Lonely Soldier to some extent too.